Thank you very much. Looking forward to a great Monday ahead. Our time now 7:41. The Medicare Open enrollment period is currently underway right now, in fact, for thousands of seniors in our area. And experts say that it's very important to pay attention to your coverage options. Christy Bell with United Healthcare is here with us this morning to tell us more about what's going on with the open enrollment. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Now, how is it different this year than in previous years?
Well, first of all, the open enrollment season started October 15th and will run through December 7th.
So we're right in it now.
We're right in it right now.
Okay.
But another thing is that the Affordable Health Care Act also has implemented Medicare. A lot of people don't realize that. The core message that was out there was that the Affordable Care Act was just for the mandated health insurance that started January 1st, 2014. But that was for people who did not have health insurance under the age of 65. So now for Medicare beneficiaries, there are some changes that it has impacted. And I think you have to look at the upsides and the downsides to that.
Now, what are some of the upsides there?
So some of the upsides are, first of all, there are more preventative services that will be covered under under Medicare Part B. So things like routine mammograms, also routine colonoscopies will be covered at no cost. A routine physical, your wellness exam every year. Smoking cessation counseling, and then also obesity screening and counseling as well.
Some good areas there.
Sure.
Now, what's the downside, though, to the changes that have happened?
Some of the downsides is, of course, the funding has changed to the Medicare Advantage plan, so you'll see some benefit changes and possibly some premium changes to their plan. So it's real important during this open enrollment period that all Medicare beneficiaries take a look at their current coverage.
Now, for those who are wanting to know, well, who do I talk to? Who do I ask for?
Sure.
Explanation of these things. Where do they turn to?
Well, there's a lot of resources. United Healthcare has a website, uhcmedicareplans.com. You could call Medicare or United Healthcare at 1-800-UHC-6509. Okay. You can go to Medicare.com, or you can call 1-800-MEDICARE 24 hours a day, 7 days a week. There's always local resources, such as the State Health Insurance Program Coordinator. They'll be glad to help you as well. Okay,
and you're also having different, I guess, opportunities throughout the community where you're actually there and they can come and have questions answered?
Sure, we have a lot of community events where people can actually come and sit down with our local representative.
That sounds like a good idea of all these changes. And usually we're talking about people who are 65 and older.
Right, most people are on Medicare age 65 and older, but you might also be eligible for Medicare under age 65 due to a disability.
All right, Christy, thanks for stopping by today and sharing this. Some serious information here going on, and of course now through December 7th. Okay, and we'll check those websites and look for you here around the area as well.
Yes, sir.
All right, Christy Bell with United Healthcare. Make sure you check on that. Right now we're going to head back over to Sarah.
Medicare open enrollment period is currently underway for thousands of seniors in our area, and experts say it is very important to pay attention to your coverage options. Christy Bell with United Healthcare joins us in the studio this morning to give us some insight. Good morning, Christy.
Good morning, Sarah.
We were just talking during the commercial break about why this is important and what's going on. So this is something that seniors need to be paying attention to. And how has the Affordable Care Act brought changes and things we need to know about?
Sure. We mentioned earlier that preventative services is one of the good positive changes that come about with the Affordable Care Act. Also, the prescription coverage gap, or the donut hole through the Medicare prescription drug side, is actually starting to narrow. So in years past, if Medicare beneficiaries hit that gap or donut hole, they had to pay 100% of their drug costs during that period of time. But for 2015, they will have a discounted rate. So if they pick up a brand name drug during their gap or donut hole, they'll pay 45% of their drug cost and 65% for generic drugs. And over time, hopefully by the year 2020, that gap will be completely gone. So that's another positive change. And then also Medicare Advantage plans are also offering more products and services to help their members live healthier lives. Just to give you an example, I know our AARP Medicare Complete HMO Plan 2 is offering Silver Sneakers, which is a fitness benefit where they can actually go and work out and have that social piece. Also, they'll have access to discounted hearing aids as well. So again, the additional benefits.
Okay, but they need to do this before December 7th, because after that you're locked in, right?
That's correct. So December 7th, just some tips that I would like to give to all Medicare beneficiaries. This is what I do for my family and loved ones. We sit down every year. I have them bring what's called their annual notification of change, which they should have received around October 1st. We sit down and evaluate their current plan. Has their health status changed this year? Has their financial status changed? You know, give me your list of doctors and your list of prescription drugs, and we need to make sure that that plan that they pick is best for them.
Okay, very good information. And we're going to put some more information, including ways that you can get help, on our website, fox10tv.com. And remember, December 7th is the cutoff, so you need to take care of any of these changes that you are making plans to make by then, right?
That is correct.
All right. Thank you very much
Thank
for
you.
joining us this morning and explaining how all of this works. Very important information. Michael?
Thanks.